This is Health Yeah, your weekly update on what's going on in the health, wellness, and medical world with Monica Robbins.
Hi, everyone. Thank you for tuning into Health Yeah, your prescription for clear, concise medical health and wellness information. Please subscribe wherever you get your podcasts. Today's episode focuses on the darker side of online dating. Licensed clinical psychologist Dr. Jennifer Kinetic works with the Veterans Administration's Intimate Partner Violence Assistance Program. While the program helps veterans, their partners, and VA staff who are impacted by intimate partner violence, her advice is critical for anyone who uses online dating. Also, the VA IPV program helps perpetrators manage their anger and behavior. What is the VA's Intimate Partner Violence Assistance Program?
Well, I'm glad you asked. I'm excited about the program. It's relatively new in VA years. We've had our program in Cleveland, actually nationally, for about 7 years now. And the program really focuses on supporting veterans and their partners who are impacted by intimate partner violence. We also serve staff. So that includes emotional abuse, physical abuse, sexual abuse, stalking. So rather broad spectrum. You may already know that women are the fastest growing cohort in the VA. But I can also tell you that just anecdotally, we serve about as many men as we do women impacted by violence.
You're also talking to veterans who do the violence. Do I have that right?
Yes, ma'am. We work with veterans who use and experience, and often that is an issue for people where they have both things going on. What we know about relationship health and safety is that violence tends to be bidirectional. So if we're serving or trying to help someone who's using, they may also be experiencing violence. So it's not necessarily a split kind of situation.
Trauma in the past?
Yeah, that's a great point. Absolutely. We will see veterans who and their partners who have a history of, unhealthy relationships, nothing currently happening, but it's interfering with their lives today.
When people think of online dating, you're not necessarily thinking this could lead to online violence. So kind of walk me through, it doesn't even have to be when you meet the person. Let's start there. Like what do people need to be aware of? Because this information is good for veterans and everybody else.
Absolutely. I think there are a couple of things to consider. So kind of the first thing I like to share with veterans really emphasizes that pay attention to your instincts. We have instincts that support our survival, and I think too often folks doubt their instincts. So if you notice things don't feel right, things are off, listen to that. And I think a lot of survivors may struggle with that part because they have a history of unhealthy relationships and they learn to doubt their own judgment. People maybe pile on to that and say, you made bad decisions, just listen to me. So I think step one is really listening to your instincts. And then there's a lot of practical things you can do. I think the first part in our national office has recently released some guidance on this, which I really appreciate. Thinking about, the number one, when you're in the act of dating, using dating apps, thinking about your profile. So one recommendation is to use a photo for maybe dating apps that are not photos that you would have on other social media platforms. This can reduce the potential perpetrator's ability to kind of do a research on you and to collect additional information about you or your loved ones that then can be used for manipulation or potential harm. So thinking about using a unique photo is one really good recommendation. Really paying attention to the person's responses to questions. If you meet someone online and they're rather vague, they get too intimate, too romantic too quickly, red flag. Another common kind of cause or area for concern that you should really pay attention to is if they let you know, yeah, I'm American, but I'm working overseas. Pay attention to that. Pay attention to folks who would ask for your address too soon, or your maybe your work address to maybe send you flowers or send a gift. That's also something to pay attention to. So a couple of ways to do some screening on the front end can be really helpful.
That's really great advice. How does human trafficking,
Mm-hmm.
how does that happen with online dating sites?
Human trafficking and IPV often overlap and intersect with online dating. Human traffickers, we are finding, use this mechanism as one way to recruit for labor and pornography. So thinking about, just being aware that online dating app services do not do criminal background checks on the users of that technology. So paying attention to that for sure. And when you think about how it can happen, some of the research we're looking at includes just collecting information regarding folks using, dating apps. Again, as I mentioned before, private information about like who your loved ones are, where you work, to use that information for manipulation or coercion to threaten you. So that's why maintaining as much privacy and caution as you can while, still getting out there if you want to is important.
Pandemic dating lately, most people have been just really meeting online and chatting online and developing these relationships. But what happens like now that, maybe they're vaccinated and it's time to meet in person? What are the warning signs? What do people need to be aware of?
Oh, I'm glad you asked. So there's a lot you can do to increase your safety when you're preparing to kind of launch yourself out into like face-to-face dating world again. First of all, we really recommend doing more assessment on the front end before you go out face to face, just like psychologists do. So having video chats with the person, ideally multiple video chats. So you get a sense of that person. And then when you think about, okay, I'm ready to go out into the world now, another principle of dating safety and really just relationship safety is bringing in other people you trust and love, letting them know this is where I'm going. Here's a picture of this person. Check on me, or if I don't check in with you, please call or come by. Um, Also, another recommendation from our national office is letting, if you're open to it, when you go on the date, say like at a restaurant, let the maitre d' or the server know I am on my first date. So other people are laying eyes on you, and they'll notice, servers, bartenders, letting the bartender know if you're at a, if that's where you are, this is on my first date. So they can be an extra set of eyes and potentially intervene if needed. Like at VA, we're teaching, bystander intervention is so critical. So letting folks know. And then also another recommendation is thinking about your exit strategy. So as you prepare for that first date, picking a place that you are familiar with can be really important and helpful, and being sure you have your own like exit strategy if you need to leave, if things don't feel right.
The top three things they need to remember to stay safe and also understand what their risks could be.
Number one would be your own psychologist, do a really good screening, assess the person. Um, Number two, I would say bring in other people, include other people, have eyes on you, let them know your plans, and maybe the third one is really pay attention to your instincts, listen to your gut. If things don't feel right, you know, take action.
If people want more information or, Lord forbid, if they've already been in a bad situation, what kind of resources are available for them?
There's a number of things we can offer. So certainly at the VA, we are happy to we serve veterans partners. There's also the National Sexual Assault Hotline, which is 1-800-656-HOPE, as well as the National Human Trafficking Hotline at 888-373-7888. So those are some resources for your listeners.
How big of a problem is this on online dating? Is there any way to measure it?
Ah, yeah, that's a great question. So I don't have, I can tell you just in general that when we look at stats on stalking, we're seeing certainly a rise in that when we look at, using technology to stalk folks. Um, in terms of online dating, I can't really give you exact numbers for that. I don't know that I have that information. But I can just let you know that we're looking at a large number of people, about 40 million people nationally are using dating platforms. And so as more and more folks use it, we just need to be paying attention. When we just look at more generally IPV, about 1 out of 4 women and around 1 out of 6 men are affected. And in the VA, we think that the stats on men are probably higher. We continue to collect information on that. What we're finding from the research in this area is that veterans appear to be more vulnerable to both experiencing and using violence than their civilian counterparts. There are a number of reasons why that may be. There's many factors that are unique to the veteran experience, and that's why VA really made the commitment to do something about it.
So the connection between IPV and just online dating, why are we mixing the two?
The short answer is because we're harmed by people who know us, and we look at online dating. More and more, there's this overlap between sexual assault, human trafficking, IPV, and dating. There's this intersection, and so the folks who do the kind of work I do are really trying to promote awareness around how to be healthier and safer in relationships from the beginning, like from before you start a relationship to dating to you're in the middle of it. So kind of like at all stages of a relationship.
As a clinical psychologist, I'm sure you are well aware of the pandemic stress that everybody has been under. Is that causing more IPV that you're seeing?
Yeah, that's a great question. So our national office recently posted some data on this, and we're finding that actually there is a significant increase in the experience of IPV since COVID. I don't have like final numbers on hand, but we're definitely noticing an impact, as you would expect. Folks are under a lot of stress.
I'm curious, for those who are the perpetrators of this violence, if somebody knows that they have a short fuse, what can they do to control that if they indeed want that control?
I love this question. This is one of the things I do in my daily life. I wish we had like 3 more hours. The short answer is, so yeah, we have a lot of programs that actually respond to that, but really awareness is number one. We look a lot at the impact of trauma, the impact of previous deployments on a person's health, and how that may make them more vulnerable, undertreated or untreated mental illness or addiction, previous relationship history. So we really work with each person to kind of get an understanding of what specifically is happening with them, and intervene that way. We're not trying to do any kind of cookie cutter treatment on that because everybody's unique.
By the time they come to see you, though, are you finding that the majority of your clients are well aware and that it was something they wanted to get under control, but they just couldn't?
That is a good question too. I would say yes and no. What we're trying to do is really reframe the conversation. So when we talk to veterans about, why don't you come to my group about intimate partner violence, that can be kind of off-putting. What we're trying to talk about is relationship health and safety. And I would argue that all of us can benefit from work on relationship health and safety. We can all do better. So I think when we try to look at the spectrum, of what does that look like? Sometimes it's, I'm stressed, I don't know how to communicate, and it can go all the way to using physical violence.
Final thoughts? What would you like to leave everyone with?
Reach out if you have questions. There's a lot of support locally in Cleveland. If you're not a veteran, we can get you connected. And I would encourage folks to just be gentle with yourselves if you are currently struggling with your relationship. This is very common. Many people need help, and I hope folks can be more compassionate with themselves and just feel less shame about it, and just reach out and ask for help.
That's great advice. Oh, Dr. Knecht, thank you so much. I appreciate your time. Please find me on Twitter and Instagram at Monica Robbins. Catch up on health news and future podcasts on my Facebook page, Monica Robbins WKYC. Video podcasts are uploaded to my YouTube channel. Just search Monica Robbins and please subscribe too. Keep up to date on all of your news, sports, and weather on WKYC.com and the WKYC YouTube channel, and please follow the WKYC social media accounts as well. Random acts of kindness are good for your soul. Practice them daily. I'm Monica Robbins. Until next time, have a healthy week.
Thanks for listening to Health Yeah with Monica Robbins from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.